Hello everybody, I am Dr. Jordan Weber and we are going to go over the adapted physical education manual that you will need to know for the final exam and if you plan on getting into adapted physical activity in the future. So I'm going to go through some slides, I'll go through some in depth and I'll give examples where needed, but I'm basically going to run through this quite quickly because these are available on the lecture site and we've gone over many of these before. So adapted physical education, what is it? It's an individualized program of physical and motor fitness, fundamental motor skills and patterns, and skills in aquatics, dance, individual and group games, and sports that are designed to meet the unique needs of individuals. What is inclusion? Inclusion refers to educating students with and without disabilities within the same environment, so including everyone. Aims and goals for an adapted physical education program. So as you see here, it's self-actualization, basically understanding your own skill set and being able to achieve independent and realistic goals yourself. The aim of physical education, that is to educate the individual on what it is to be physically active, what it is to be healthy. Program goals, affective, social, obviously the biggest one would be psychomotor, and then cognitive, being able to learn psychomotor. And then content goals, physical fitness, motor development, rhythm and dance, aquatics, and games and sports. Physical fitness, working out the gym, resistance band, dumbbell training, squat body resistant training. Motor development, learning new patterns, locomotor skills. Rhythm and dance, learning steps, learning how to move in space. And then games and sports, obviously being unified sports or Special Olympics. And then also the cooperative games like parachute and sharks and minnows and all the fun stuff that we do in PE. The least restrictive environment is where we teach individuals with disabilities, and they are educated um, with individuals who are not disabled, and special classes, separate schooling, or other removal of children with disabilities from regular physical education environment occurs only when the nature of the child's disability is such that education in regular classes with the use of supplementary aids and services cannot be achieved satisfactorily. So basically, you're always trying to educate the individual in the least restrictive environment. Um, you know, if they don't need adaptations or modifications, then you don't need to change anything, basically. If you do need to change the situation or the environment, and that's basically what least restrictive environment means. Special education means specially designed instruction at no cost to parents or guardians to meet the unique needs of child with disability, including instruction conducted in the classroom, in the home, in the hospitals and institutions, in other settings, and in physical education. Related services, this basically means refers to transportation, developmental, corrective, and other supportive services required to assist child with disability to benefit from special education. Related services include speech language pathology and audiology services, psychological services, physical and occupational therapy, recreational, including therapeutic recreation, early identification and assessment of disabilities in children, counseling services, including rehabilitation counseling, orientation and mobility services, and medical services for diagnostic and evaluation purposes. Related services also include school health services, social work services in schools, and parent counseling and training. Physical education in the Individuals with Disabilities Education Act, or IDEA, the term physical education refers to the development of the following: physical and motor fitness, fundamental motor skills and patterns, skills in aquatic dance, individual and group games, and sports, including intramural and lifetime sports. The highlight of the IDEA is a right to a free and appropriate education, that physical education be made available to children with disabilities, equal opportunity for non-academic and extracurricular services and activities, and individualized program designed to meet the unique needs of children with disabilities. What is Section 504? Section 504 of the Rehabilitation Act provides that no otherwise qualified individual with a disability solely by reason of disability be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. So anything that is receiving federal dollars has to be inclusive for people with disabilities. Implications of Americans with Disabilities Act of 1990. This extends civil rights to all areas of American life, requires that community recreational facilities be accessible, requires reasonable accommodations, links skill learned in school with community-based recreation. As far as Every Student Succeeds Act, this is in current use, and this is providing a framework for elementary and secondary education in the United States. This includes health and physical education as part of a well-rounded education, provides funding for health, physical education, and physical activity programs, encourages development of community learning centers, school and community partnerships, and after-school programs. So basically the continuum of alternative instructional placements in physical education, there's different levels. General class placement would be level 1 and all the way to level 9, hospitals and treatment centers. So there's most restrictive and least restrictive environments. Movement as soon as possible in level 1, and then move only if necessary, you know, in the higher levels. So depending on the individual, to be placed in a different level. What are good adaptations? Good adaptation promotes interaction and interplay. It meets the needs of all students in class. It improves or maintains self-esteem. It provides physical activity and provides a safe experience for all. The key functions for successful inclusion. This is identifying unique needs, determining appropriate instructional settings and support services, individualizing instruction, adapting activities, preparing general education students, and preparing support personnel. A sport program, what is it? A sport program builds on the basic instructional program. Students with disabilities should have equal opportunity to obtain the same benefits from extra class programs as peers without disabilities. Participation should be provided in at least the restrictive, most normal, and integrated settings possible. So really don't change anything unless you need to. And the things that you do need to change, make sure that you are you're doing that with proficiency and you're being proactive. You're not just what happened, like, oh, I didn't know that somebody with a disability was going to come, I'm not prepared. You should just always be prepared for any situation if you're an adapted physical education teacher or any trainer in general. So Section 504 basically states here, no otherwise qualified individual with disability in the United States shall solely by reason of her or his disability be excluded from the participation in or be denied the benefits of or be subjected to the discrimination under any program or activity receiving federal financial assistance. That's something that we've already gone over. Sports framework for individuals with disabilities. So there's a sports setting, which can be school-based, interscholastic, community, college, and open. We do have college programs involving unified sports. There's different options. It can be virtual, digital, internet, and electronic. It can be parallel, it can be segregated, unified, and it can be general and regular. Transition services. Programs should provide a clear transition between the school and community living. Transition services in physical education and sports should begin early than age 16 to foster independence and inclusion. So the earlier the better. Physical education should use the IEP to identify and recommend extracurricular programs including intramurals and general sport, and that is an individualized education plan, which sets goals based on individuals' present level performance. Benefits of adapted sport and general PE. Make it part of an individualized education plan. Teaching adapted sport in the general physical education curriculum promotes inclusion, develops a more comprehensive general PE curriculum. It develops social networks between all students and helps students with disabilities improve their sport skills. 4 key steps to teach, implement adapted sport in general physical education curriculum. Cross-reference the general sport to adapted sport. Learn about similarities between general and adapted sport skills and rules. Assess the skill performance for all students and implement and teach. What to assess in adapted PE? Remember the ideas, definition of physical education, physical and motor fitness, fundamental motor skills and patterns, skills in aquatic dance and individual and group games and sports including intramural and lifetime sports. Criterion reference standards are used to assess competent meets standard and non-competent does not meet standards. All the types of judgments are made. We use FitnessGram, we use Brockport physical fitness tests, and these are instruments that use Criterion reference standards. An individual performance score is compared to a healthy fitness zone Criterion standard in the Brockport physical fitness test. There are checklists, identify presence or absence of behavior or skill. This is also an assessment. Do not indicate the quality of behavior, are helpful when using task analytic or ecological approaches. Use with specific skill or series of skills when you're looking at checklists. So can they grasp the ball? Can they rotate their trunk, stuff like that. Rubrics, student performance is matched to one of the multiple levels of a skill via a set of criteria. Students know where they stand and what needs to be done for improvement. Quantitative and qualitative analytic rating scales are examples. So rubrics help us basically see what level we're at, and then they can see what we need to do to improve by looking at the levels in front of us. Task analysis, many types exist, but all involve breaking skills down into smaller, perhaps sequentially ordered steps or focal points. When used as an assessment instrument, missing components are identified and a strategy for teaching is revealed. It can be expanded for use in ecological assessment, including functional and top-down approaches. Determination of unique need, so basically less than the 15th percentile or more than one standard deviation below the mean. Could be 2-year or more developmental delay, failure to meet criterion reference standards, a failure to meet 70% of the competencies in the curriculum. So that's how you would know that they have a unique need. Other factors to consider: behavior, communication, need for adapted PE, need for safe participation, medical condition or disability, potential for intramural and interscholastic athletic experiences. So they might be very high functioning, they might be very low functioning, and you need to determine the unique need of each individual when creating an individualized education program or adapted physical activity class or program, either or. What to assess? Mentally tests physical activity and motor skills, including reflexes and rudimentary, fundamental, and specialized skills as appropriate. Basically, walking, jogging, skipping, leaping, tagging, pushing weight, pulling weight, squatting, basically anything you'd see in a physical education class. Affective skills may also be assessed in authentic settings, so we are in a authentic setting, so we do assess and examine the affective domain, which is their social behavior, and we do try to stimulate that affective behavior when we lesson plan. Test of gross motor development, or TGMD. This is to test fundamentally movement patterns, preschool and early elementary children, with emphasis process rather than product of performance. 12 patterns tested within locomotor and object control subtests. So object control would be throwing, kicking, dribbling, batting, stuff like that. Locomotor would be running, skipping, sliding, that type of thing. So comment: criterion-based scores compare with norm reference standards. Brockport physical fitness tests. Purpose to assess the health-related fitness of young people aged 10 to 17 with certain disabilities. Typically 4 to 6 test items selected from 27 possibilities on a personalized approach. So you're basically picking out 4 to 6 that match your individual, and then you're doing a pre, middle, and post test. Test scores compare with criterion reference standards based on gender, age, and in some case disability. So it does compare with individuals with disabilities and without. Closely related to the FitnessGram and supported by computer software. So a great thing to use as an administrator. Sports skills program guides to assist in the assessment and instruction of sports skills for people with disabilities age 8 and beyond. So after the age of 8, we can get them into sports skill programs, get them into Special Olympics, Unified Sports, Paralympics, whatever it may be. Description, tests, and analyze assessments available for 29 different sports. Scoring focal points checked off as athletes demonstrate correct techniques. And this is used by Special Olympics. The very strong, authentic, but no validity or reliability reported, so no one's really doing any cross-reporting. But I really do like this. It is an authentic assessment. It's just more research needs to be done. As far as program evaluation, Increasing important to demonstrate that an instructional program is good, not merely claim it is good. So this program obviously needs a program evaluation to oversee making sure that we are lesson planning, we are setting goals, we are accountable for our structure. It requires that programs' goals be clearly articulated, so you have all clearly articulated goals each class. Program goal should include criterion. 90% of all students will engage at least 30 minutes of moderate level physical activity at least 4 days per week. We get them for once, so we're not responsible for the other days, but their teachers are. Student data are aggregated to evaluate the program goal. Individualized education programs, that's something we talked about. Depending on the circumstance, any one of the 4 types of individualized plans might be required or recommended for students with unique needs in physical education. Under IDEA, all students with disabilities aged 3 to 21 must have an IEP that outlines a child's special education related services. Physical education is only one part of this comprehensive IEP document, so there are other components, but physical education is on there. Individualized education program, at the state's discretion, infants and toddlers with disabilities 0 to 2 must have an individualized family service program. And students with disabilities not covered by IDEA would be still entitled to equally effective benefits under Section 504. Continued, a little bit more information if you want to go ahead and pause and read that. As far as what we're looking at, state and local school districts may require additional information, but 9 components, these 3 specifically, present level of academic achievement and functional performance, measurable annual goals, short-term objectives and benchmarks, description of measuring and reporting progress toward those goals and to parents or guardians. So the present level of performance, this includes statements of how disability affects a child's progress in general curriculum. It is the cornerstone of the IEP, consists primarily of test results, and can also include informal assessments and observations. Annual goals, these goals state that what a student is expected to achieve in a given year. Measurability requires specificity. States can require districts to include short-term objectives or benchmarks with annual IEP goals. Writing these goals, you can look more into this if you want to pause and go back, getting deeper into the IEP as far as the 6 elements. And then I also have some different examples. So if you want to pause at any time and read these different examples and goals for the IEP. As far as how to increase behavior, here's a diagram of the operant conditioning if you want to pause and check that out. You can shape, chain, prompt, fade, model, token economy, manage, and discrete trial training. Those are different procedures. As far as ABA, identify the target behavior, establish baseline, set the objective, and choose a reinforcer. Maslow's theory of self-actualization, how do you get there? Basically, you find the deficit needs, physiological needs, safety needs, belonging needs, esteem needs, and then being needs, and that would be self-actualization. Differentiated instruction, learners have often unique attributes that must be taken into account when teaching. For optimal learning to take place, we must differentiate our approach based on what skills and shortcomings an individual learner presents. Modifications are used only as needed. For assisted technology, this refers to any equipment, device, or system that maintains or improves functional abilities as well as the training of students to use this equipment. Allows students to capitalize on their strengths and minimize their shortcomings. Allows for increased learning and functional independence. Effective teachers adapt their instruction. So with respect to the nature of the content being taught, with respect to their personal skills and preferences, with respect to the characteristics of the learners, and with respect to the teaching context. Teaching formats, one-on-one, small group, large group, mixed group, and peer teaching or tutoring. Response prompting continuum, so there's physical prompts, there's visual prompts, that can be gestures, partial skills, complete skills, As far as verbal prompts, that can be a skill cue, it can be an action command, it can be an action cue, or there could be no prompts, imitation, just be free play. Guidelines for effective programming: use prompts that are meaningful to the student, consider the learning's characteristics, be careful not to under-prompt, be careful not to over-prompt, focus on the learner's attention on the task. And so this would be an example of a general task analysis if you want to pause and check that out. The definition of the disabilities that we're going to mainly focus on for the purpose of this course are intellectual disability, which is characterized by significant limitation in intellectual functioning, significant limitation in adaptive behavior and expressed as conceptual, social, and practical adaptive skills, and origination before the age of 18. And so here's a diagram of the different levels and IQs. What causes this? Well, there's several hundred causes of intellectual disabilities. There are more than 750 genetic disorders associated with intellectual disabilities. Most prevalent genetic cause is Fragile X syndrome. Disorders can be biomedical, social, behavioral, or educational. Social and emotional characteristics of individuals with intellectual disabilities, some ranges of social behavior and emotion, more frequent inappropriate responses to social and emotional situations, difficulty generalizing information, difficulty learning from past experiences, thus often exposed to situations they are not prepared to handle, more often do not fully comprehend what is expected of them, thus respond inappropriately. Physical and motor characteristics differ least in physical and motor domain. The greater the intellectual deficit, the greater the lag in development. Walk and talk later, slightly shorter, more susceptible for physical problems and illnesses. Extensive support needs, 4 years behind peers in physical and motor tests. Down syndrome, this is the most recognized genetic condition associated with intellectual disabilities. 1 in 691 children are born with Down syndrome. Over 80 clinical characteristics and many physical characteristics. Increased risk of certain medical problems. These are a list of some of the different Special Olympic sports. And we have some more here. As far as our unified sports, those are inclusive sport opportunity. Teams have equal number of athletes with and without intellectual disabilities, complete in local, regional, county, and state competitions. As far as Paralympic Games for individuals with intellectual disabilities, these games are equivalent to the Olympic Games. The games include athletes with spinal cord injuries, amputations, blindness, deafness, cerebral palsy, intellectual disabilities, and loss of choice. The games are conducted every 4 years just after the Olympic Games and at the same venues. As far as what an emotional disturbance is, it's an inability to learn that cannot be explained by intellectual, sensory, or health factors. An inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behavior or feelings under normal circumstances. And here's a chart on that. As far as autism spectrum disorder, the definition from IDEA is a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before the age 3, that adversely affects a student's educational performance. History: Dr. Leo Kanner described 11 children he studied having early infantile autism, a form of mental illness. Hans Asperger, an Austrian pediatrician, described children he studied who displayed a similar characteristics as having Asperger's. History of ASD: Dr. Bernard Rimland identified the condition as biological neurodevelopmental disorder. Established different societies later on. As far as the physical and motor characteristics, broad spectrum of abilities from mild impairments to severe. Some may have hypotonia, delays in attaining motor milestones, toe walking, motor apraxia. The incidence: 1 in 68. Males are 5 times more likely to have than females. Is now the second largest childhood disability condition. Persistent deficits in social communication and interaction, difficulty engaging in social reciprocity, difficulty using nonverbal communication for social interaction, difficulty developing, maintaining, and understanding relationships. As far as restricted repetitive patterns of behavior, interests, or activities. Engages in repetitive motor movements, use of objects or speech. Insists of sameness, routines, and ritualized patterns of behavior. Displays restricted interests that are abnormal in intensity or focus. Overly sensitive to sensory input or unusual interest in sensory aspects of the environment. Difficulties in the social use of verbal and nonverbal communication. We have deficits in social communication such as greetings, others, and sharing information in the manner that is appropriate for the context. Difficulties understanding what is not explicitly stated. Difficulties understanding ambiguous meanings of language. The TEACH program, this presents information visually in a highly structured and organized manner for individuals with ASD, uses routine schedules and predictable environments, incorporates sensory integration therapy to assist in reducing sensory overload. Implications for PE. Activity selection is huge, selection based on the needs and interests of the child. Generally, individual and small group activities preferred over competitive team sports, sensory-motor activities that stimulate the senses with a focus on kinesthetic awareness, tactile stimulation, auditory processing, and visual motor coordination are recommended. All things that we do here. Terminology of deaf, the cultural perspective of deafness as a linguistic minority. It's not a disability. Deaf, the medical perspective of deafness as a disability, not a culture. So different meaning depending on the lower or hard case D. Hard of hearing, the term used to describe individuals who are not deaf but have significant hearing loss, not hearing impaired. Two different types of hearing loss, conductive, middle ear, some hearing might use speech, and then sensorineural, inner ear, limited hearing might use sign language. They may need a cochlear implant and may have some balance issues as well. As far as motor characteristics, sensorineural loss might have balance problems. If given equal opportunity, will have equal motor skills. Fitness levels are equal to those of hearing peers, and parental influence is a major factor in psychomotor development, so parents are a huge factor. Cerebral palsy, a group of permanently disabling conditions, damage to motor control areas of the brain. Symptoms vary from mild, only slight speech impairment to severe, total inability to control body. Other symptoms associated with CP, speech and language, intellectual disability, and sensory impairments. The most common motor disorder in children is cerebral palsy. Topographical classifications, many different types. You can pause and read that. And then also different types of neuromotor classifications as well are involved. As far as CP and educational considerations, managed can't treat, managing motor function, improve muscle control, muscle relaxation, functional skills. Abnormal reflex development interferes with developmental functional skills, kicking and throwing, physical therapy. Primary concerns develop total person, use of collaboration or team approach. Usually you need more than just one person helping you with an individual with CP. Lots of times they need help with physical assistance. As far as traumatic brain injury, as cognitive impairments may result in short or long-term memory distance, poor concentration, altered perception, communication disorders, reading and writing, and poor judgment. Social, emotional, and behavioral impairments include mood swings, lack of motivation, low self-esteem, inability to self-monitor, depression, sexual dysfunction, excessive laughing or crying, and difficulty with impulse control. Fitness and spinal cord injuries, obesity can occur, general level of fitness is a little bit lower. Emphasis on fitness needs to be important. Flexibility, strength, endurance is important. Dealing with muscle imbalances would be huge. The Brockport physical fitness test would be really good for people with spinal cord injuries. As far as dietary considerations to promote weight loss, we want to restrict calories to 10 calories per pound, 0.5 kilograms of body weight. Example, 1,600 kcals per day for a 160-pound person. Reduce intake of saturated fat. Daily intake should not exceed 30% of calories, and saturated fats, including trans fatty acids, should not exceed 10% of total caloric intake. Increase intake of dietary fiber and complex carbohydrates. That is a huge thing for most people, this whole slide. As far as physical activity, where do we get it from? Exercise, sport, training, dance, and play. It can be structured by frequency, intensity, and duration. Health is your physiological health, and there is your functional health. And then you have your health-related physical fitness, which is aerobic functioning, body composition, musculoskeletal functioning. Physical activity, defined as any bodily movement produced by skeletal muscle resulting in substantial increasing in resting energy expenditure. Categories include exercise, sport training, play, dance, work, and domestic chores. Patterns of physical activity are arranged by frequency, intensity, and time, or the FIT principle. Health. Health is a human condition with physical, social, and psychological dimensions, each characterized on a continuum with positive and negative poles. Positive health is associated with the capacity to enjoy life and withstand challenges. Positive health is not merely the absence of disease, really just being happy. Physical fitness, defined as the ability to carry out tasks with vigor and alertness without undue fatigue and with ample energy to enjoy leisure time pursuits and to meet unforeseen emergencies. Categories include skill-related fitness and health-related fitness. Components of skill-related fitness include power, speed, agility, balance, coordination, and reaction time. Aerobic functioning. Adjustments for youngsters with disabilities include frequency, no change unless disability can be exacerbated by regular activity, intensity, reduce as functional of fitness level, and adjust target heart rate zone for arms only activity for quadriplegia, and time, accumulate more intermediate activity or reduce total time if necessary. Physical activity recommendations for body composition. We went over this a little bit ago. So weight loss goals generally can be achieved by following aerobic functional guidelines. When weight loss is higher priority than aerobic functioning, the recommendation is 60 minutes per day of moderate activity conducted 5 to 7 days per week, and at least 1,000 calories burned working out a week. Physical activity recommendations for muscular strength. At least one set of 8 to 10 exercises at least twice per week with at least 1 day of rest between sessions. Do it 8 to 12 reps for strength, 15 to 25 for endurance. Intensity is a function of the amount of resistance that is overcome with the reps or expressed through RPE recommended. Physical activity recommendations for flexibility. At least 3 exercise sessions should be done each week. Each stretch should be held for at least 15 to 60 seconds and repeated 3 to 5 times per session. Intensity is a function of the perceived mild discomfort during the stretch, and stretching generally is more effective after the muscle tissue is warm. Adapted aquatics, one thing that we love here, swim strokes that we assess. And other aquatic skills, there's competitive swimming, there's small craft, water aerobics and fitness, and other water-based instructional and recreational activities. Inclusion tips for aquatics: use an alternative activity to one that might be inappropriate, jump versus dive, have teaching assistants repeat directions or provide physical support, use a temporarily segregated program. Peers who are trained as water safety aides or assistants can be helpful in providing specific assistance. Rhythmic movement, where to begin? Begin with awareness of internal rhythms and then match with external rhythms. Ask students to match breathing patterns or simple arm movements with external rhythms such as drum beats, and create a rhythm such as lift and lower one arm, repeat one movement, and repeat, add breathing, and repeat. Okay. So these were about 50 slides of what I thought was the most relevant information concerning adaptive physical education at the introductory level, and most of this information we've gone over. You've actually had the experience to actually see this in action, so hopefully you've learned a lot from this course, and that you can take away through the experience and hopefully through some of the lectures as well. So this is your final review video for the exam. Please read all the directions in the email and make sure that you are ready and prepared for the final. Thank you.